Bismillahirrahmanirrahim. These are the important BCQs regarding mediastinum. Question number 1 is the sternal angle marks the level of tracheal bifurcation and the start end of the aortic arch. It lies at the intervertebral disc between which vertebrae. It is at a level of T4 to T5. Reason is the sternal angle corresponds to T4 to T5 disc level. Question number 2 is the posterior boundary of the inferior thoracic aperture is formed by the body of which vertebrae. It is T12, inferior thoracic aperture base posteriorly at the level of T12. The costal facets on the thoracic vertebral body articulate with which vertebral structure? It articulates with the head of the ribs. The transverse process of a thoracic vertebrae has a facet for articulation with which rib part? Rib tubercle articulates with the transverse process. The pericardial sac lies posterior to the anterior end of which ribs? Heart location spans at the second to fifth anterior ribs. A fracture involving the manubrosternal joint, sternal angle region, would most likely fracture at which rib? The second rib articulates with the sternal angle. The mass compressing the arch of aorta is located at which level? It is present where it is present in the superior. A reason is aortic arch lies in the superior mediastinum. The contents of both all the mediastinums are very important. Lower thoracic esophagus lies in which mediastinal compartment? It lies in the posterior compartment. Esophagus lies in the posterior mediastinum. Superior vena cava compression at the upper thoracic thorax region is called which inlet? This is called as thoracic inlet. Superior vena cava enters the thorax by the thoracic inlet. Which structure passes through the thoracic inlet? Common carotid arteries, because the major arteries pass from the thorax into the neck here. Question number 11 is a 32-year-old athlete was hit in the chest during a football match and sustained a fracture of the upper ribs near the costovertebral joints. He is now experiencing difficulty with increasing the anterior-posterior diameter of the thoracic cavity during inspiration. Which ribs normally perform this movement? Second to sixth rib perform this movement. Pump handle movement occurs mainly in the ribs 2 to 6, that is second to sixth rib. Elevates sternum and increase anterior-posterior diameter. This can be asked to you in any way. A patient with the sternocostal joint arthritis has painful elevation of the sternum, especially during deep breathing. Which movement is most restricted? Pump handle movement is restricted. Pump handle relies on the sternum elevation. It impairs in the sternocostal joint disease. A 60-year-old man has difficulty increasing the transverse diameter of his thorax during inspiration due to the lateral rib injuries. Which ribs primarily perform this expansion? 7 to 10th rib perform this expansion. Bucket handle occurs at 7 to 10th rib. It increases the transverse chest diameter or the width. It can be asked to you in any way. A 45-year-old trauma patient has fractured the costo transverse joint of the ribs, that is second to fifth rib. Which the breathing action will most likely be reduced? Forward and upward movement of the sternum will be reduced. Reason is pump handle movement involves ribs second to sixth rib rotating at costo transverse joint. Sternum will lift. In question number 15, in a patient with COPD, accessory muscles are helping to expand the chest. To maintain oxygenation, the upper ribs elevate excessively. Which motion is exaggerated? Pump handle motion is exaggerated. Accessory muscle breathing strongly lifts upper ribs and the sternum. So this is the pump handle dominancy here. 16th question, a 29-year-old man has a fracture of rib 8 to 10th rib following a road traffic accident RTA. Which change in thoracic cavity will be decreased? Transverse expansion will be decreased, because ribs from 10 to 8 level produce bucket handle movement, that is widen the thorax laterally. A patient has ankylosis of the manubrosternal joint, making the sternum rigid. Which effect will be seen during inspiration? It decreases the pump handle movement. A reason is manubrosternal joint allows the sternum to move anteriorly, which is needed for the pump handle. In 18 question, in a gunshot injury, the first rib and costovertebral joint is damaged, leading to impaired movement at the sternoclavicular area. Which breathing movement is most affected? Elevation of the upper thoracic cage, that is pump handle movement, is affected. First rib, no buccal handle, contributes mainly to the upper rib elevation. It can be asked to you in any way. Question number 19 is a person with flail chest involving ribs 3 to 5 rib cannot expand the chest anteriorly during forced inspiration. Which diameter is reduced? Anterior posterior diameter is reduced because ribs with a level of 2 to 6 handles pump handle movement, anterior posterior expansion is lost, paradoxical movement will be performed. A medical student palpates the sternum rising forward during the deep inspiration in a healthy subject. What does this reflect? It reflects the pump handle movement in which increases the anterior posterior diameter. Forward sternum lift. This is a classic pump handle effect. A construction worker fractured the neck of the seventh rib. Which structure normally articulates at this location? Head of the rib and transverse process articulates here. Rib neck lies between the head and the tubercle near the costotransverse joint. 22 is a 55-year-old man suffers a posterior chest injury affecting the costovertebral joint of the rib. Which part of the rib participates in this joint? Head participates because rib head articulates with the body of the same vertebrae and one above. In question number 23 is a stab wound injuries the articulation between rib 8 and the sternal body. This joint is classified as synovial plane joint. Rib 2 to 7 synovial sternocostal joint except first rib cartilaginous joint. 24 question is trauma to the tubercle of the rib would impair articulation with which structure? It articulates with the impair with the transverse process. Costotransverse joint is equal to rib tubercle will articulate with vertebral transverse process. Okay. Men with a fractured rib, first rib has difficulty elevating the upper thorax. Which feature explains this articulation only with the T1 vertebrae? It is a unique feature, single facet, limited motion, vital for the pump handle, which we have already discussed in the previous BCQ. Question number 26 is a patient has pain along ribs 11 to 12 after a fall. Why do these ribs show maximum mobility? No neck or tubercle. Because floating ribs, no anterior attachment, no costotransverse articulation. Question number 27. A fracture near the angle of the rib causes intercostal nerve irritation. Why? Costal groove presence. Reason is neurovascular bundle runs in the costal groove near the angle. It is a common injury site. Question number 28 is a 14-year-old boy has pain at the junction of the rib and cartilage. What is the name of this site? It is costochondral joint. Reason is costochondral is equal to rib plus cartilage, no movement firm. Other questions that related to the mediastinum contents and compression effects are question number 29 is a tumor behind the sternum compress the thymus region. Which structure is most likely affected? Left brachiocephalic vein is most likely affected. A 70-year-old man has difficulty swallowing. CT scan shows a mass in the posterior mediastinum. Which structure is compressed? Esophagus is most likely compressed. A gunshot wound damage a structure anterior to pericardium but posterior to sternum. Which area is involved? Medial mediastinum. Middle mediastinum contains heart pericardium, which is very important. During surgery, a swollen lymph node is found posterior to the trachea and anterior to vertebral bodies. It lies in which mediastinal part? It lies in the superior mediastinal part, superior mediastinum. 33 question is a patient has hoarseness of voice due to the compression of the left recurrent laryngeal nerve. Which mediastinal structure may be enlarged aortic arch? That is going to compress. Question number 35. Question number 34 is a knife penetrates to the posterior mediastinum. Which major vessel is most threatened? Descending thoracic aorta is most likely threatened. A mediastinal cyst is compressing the esophageal hiatus area. Which vertebral level does this correspond to? It corresponds at the level of T10. Esophagus enters abdomen at T10 level. T8, T10 and 12. That is mnemonic here lies. IVC at the level of T8, esophagus T10, aorta T12. Descending thoracic aortic aneurysm. Which artery is a direct branch? Intercostal artery is a direct branch because posterior intercostal arteries arise directly. Thank you.